who do you turn to now? At Wedemark Keith, we have been helping putting lives back on track for over 30 years. Please make us your first call.
Call Wedemark Keith, the name you know and trust.
Welcome back. Our conversation continuing this morning about COVID-19, the vaccine, the masks. Will there be a mandate again? How safe are our kids going to school for parents who are choosing the opt-out option where they have one? Let's keep it on the vaccines for just a minute,
Sure.
though, and then we'll get to masks. The kids who are 17 and under, or 12 to 17 rather, why is Pfizer the only vaccine available to them? Do you know?
So that is an issue with the FDA and how it approves the vaccines. There is data, Moderna already has data that is public that the vaccine is safe for that 12 to 17. Now it's up to the FDA to approve it.
So if both Moderna and Pfizer are the mRNA vaccines, without having to take up all of our time, is it easy to explain why Pfizer has something different in it, I guess, than Moderna?
I think both of them are really essentially the same in how they work, in the technology that was used to make them.
Mm-hmm.
And if I may, can I take some time to explain how these work? So
I wish you would, because that was my
understand?
next question. Yeah.
So all the vaccines that we have, the goal is for the vaccine to initiate an immune response, and for that person who's getting the vaccine, they get the exposure without getting the actual infection. So that's what vaccines do. The mRNA vaccines, basically what they are is there's genetic information of part of the SARS-CoV-2 virus, and it's called the spike protein. And what they've been able to do is they've packaged the genetic information of only that part of the virus. There is no virus in the vaccine. There's a genetic component of the virus. And what they've been able to do is they've packaged it into a bubble of fat, essentially. And that bubble of fat is sort of what transports the information to our cells. Once our cells see that fat bubble, and once they get into the genetic information that is in the bubble, then they basically have a menu, sort of like a cookbook. Oh, I'm supposed to make this antibody. It's the antibody that ultimately will be used to protect that person from the virus if they get it, right? And so that is essentially what the vaccines do. The mRNA vaccines both do that. The J&J, the concept is the same. We're delivering genetic information for the immune system to get that cookbook. But what the J&J does, how it transports it, instead of being a bubble of fat, it's a virus, an inactivated virus. It's not SARS-CoV-2. It's not the virus that causes COVID-19. Mm-hmm. It's a virus that's weakened, and it's unable to reproduce, and it's unable to do anything, essentially. So it's serving basically like an Uber, right? It's transporting the genetic information into the body for the immune system to see it.
The bubble of fat
Yeah.
in the mRNA.
Yeah.
Is it human fat?
I don't think it's human fat. It's a nanoparticle that's produced, that's manufactured.
Okay. So for people, I was not going to go this direction, but I think I will for a minute. For those who are unvaccinated, I can't speak for everybody who's unvaccinated, clearly, but I think that a lot of people feel like they have concerns, and that if they try to voice their concerns about what their particular fears are, they're almost laughed at. Do you get that sense?
So I think we're definitely in a situation where we have polarized ourselves into vaccinated, non-vaccinated. And that's unfortunate because both sides have valid points that need to be discussed. And so what I think for those that are unvaccinated, that feel that fear, that feel that they may be made fun of, I think it's important for everybody to sit down and have the conversation, have a one-to-one conversation. A lot of the concerns many of the unvaccinated people have are valid concerns.
Like what?
So concerns of, what are the long-term effects of the vaccine? Or this vaccine was done too quickly. We don't know enough about the vaccine. Those are valid. That said, there are a lot of concerns that they have that are really not so much based on science, but more a result of the misinformation that's out there. I think a lot of the people that are unvaccinated and still have fears have unfortunately gotten too much misinformation, and the only way I think that we're going to move the needle is to have the discussion with them, not make fun of them. Let's not make fun of each other. This is a pandemic. This is a virus that doesn't really care whether you believe in vaccines or you don't believe in vaccines, or whether you think masks work or you think masks don't work. The virus is not going to discriminate. It just wants to infect.
Right.
So what we need to do as public health is we need to make sure that everybody has the information that they need to make the right choice.
Right.
It is a choice, but people need to have the information, the appropriate information to make the choice. And nobody should be making fun of either sides.
You said something that there are some valid concerns. Just to clarify, do you mean by valid that it's a reasonable thing to ask, or do you mean by valid maybe we don't know?
I think there's a bit of both. So in terms of, let's just take the concern that it was made too fast, right? That's a valid concern for anybody, right? But it's also grounded in probably not having the right information.
Who
Right.
does have the right information?
So that's a good question. And I think people need to find the source of information that they need from respected sources, right? So the CDC, the information that's put on the website for the CDC or the NIH or the American Academy of Pediatrics, the information that is there is vetted, is looked at. If it's something that doesn't seem scientifically sound, they're not going to put it up there, right? So I think when trying to decide what source you want to get your information, it's important for you to do your research and make sure the source is reliable. It's not a source that's giving you half the story, or it's not a source that is potentially pushing their own agenda. And I think that's why it's hard for those that have that are still on the fence. It's like, well, who do I believe?
Right.
Right?
Right.
Maybe I don't believe that person, or maybe I don't believe that person. Then there are ways that the internet's really good, but it's also our enemy, right? People can get on the internet and get good information from good websites, but there's many more websites that are bad.
And you know what happens on the internet too, and neither one of us is credentialed to go down this territory. I will say, however, that the way you search for something on the internet has changed.
Yes.
And your ability, so I think most of us, if we're going to be truly honest, I think most of us could say that we know somebody or closely know somebody, like through an immediate friend or something, who has had something occur as a result of COVID itself, maybe from the vaccine. And so to educate, you try to look it up.
Right.
And you can't find anything. And that's concerning.
Yeah, you're right. I'm not credentialed to tell you how the internet works.
Nor am I.
And how information is sort of put out there, and the algorithms that Facebook may use, or Twitter, or all these other social networks. But I encourage people who have a doubt or who have a concern, find a person you respect.
Could the health department be a resource?
The health department is definitely a resource. We have our COVID hotline that any call that comes in, any concern somebody brings up, somebody's going to address it, either at the hotline, or if they prefer to have a physician call a person. I call people every day, and I speak to a lot of people that have, like I said, really valid concerns, but I spend most of the call trying to tell them, look, some of the information that you're basing this on is not correct, right? And I'll give them the correct information, but the key is I meet them where they are, They need a space where they feel respected and not made fun of.
Correct. Okay, last thing on the vaccines. Boosters.
Yes.
There is a talk about that. Some of them are out now. Do you think the expectation is the hope that one booster will be sufficient, or do you think we're looking at this? You smiled.
So I think we definitely now know that a booster is going to be something that is already approved and will probably start to happen by mid-September. So we know, like we mentioned earlier, that our antibodies wane over time. They start to decrease. So we want to make sure, particularly now with the Delta being so highly contagious, that we protect everybody, and those that we started protection need a booster. So I do think we will need a third, but I also do think that we may need a COVID vaccine every year like we do with the flu.
And if you got Moderna, can you switch to Pfizer?
You can. It's recommended that you stay with the manufacturer that you started with,
Okay.
but if it's hard for you to get that same one, you could certainly get the other one.
Okay, take a breath. We're going to take a break. When we come back, we'll touch a bit on masks. And again, your kids, Dr. Urrego and I both are parents. He has a 10-year spread, right, with yours,
That's
6
right.
and 16?
That's right.
I've got 17 almost and 23, so we'll talk about the effect it's having on our kids and how to keep them safe when we're back.
Hey, neighbor, I thought you got something to keep the leaves and debris out of your gutters. Oh.